What's up, guys? Welcome back to my channel. My name is Lori. If you are new here, I am a family nurse practitioner, and today I am going to talk about practicing independently. Should nurse practitioners have the right to practice independently? Physician assistants, should they have the right to practice independently? I'm going to talk all about it and why a lot of physicians do not like the idea of this. This is something that I have been asked multiple times by a lot of folks. If I am going to open my own clinic, do I want to have my own clinic? All the time. And I get this so much. My answer was always no, but that was me personally. There is a legislation, I think, from the AMA, American Medical Association, that actually tries to stop certain... I'm gonna find it for you because I saw this and I'm like, this is actually a pretty good thing to talk about. I think it's hashtag stopping scope creep, something like that. I'll put it on the screen. So, the American Medical Association secured more than 70 state legislative victories stopping inappropriate scope expansions of non-physician in the past 2 years. These includes nurse practitioners being able to practice independently, independent practice of nurse anesthetist, independent practice of physician assistant, and whether psychologists can provide, can prescribe psychotropic drugs, stopping optometrists from performing surgical procedures, and stopping pharmacists from prescribing medications. To practice medicine in the US or to prescribe medication, you either have to be a medical doctor, a DO, nurse practitioner, or physician assistant. Those are the only four that I believe can prescribe medication and practice medicine legally in the US. And there are some rules and regulation and limit to the amount of things that we can do, because nurse practitioners as well as physician assistant, we are under the umbrella term mid-level provider. Some people hate the term mid-level provider. I really don't care. But if we really think about it, we are not physicians. Physicians, like we know, they go to school for way more years. They get way more training than a nurse practitioner as myself or a physician assistant gets. I do believe that there should be still a level of respect for the physicians. It should be. That's just my thoughts on that. Now, let's talk about physician assistant and nurse practitioners. Some people do say that physician assistants are better than nurse practitioners. To become a physician assistant, you have to have a 4-year degree prior to applying for the program. So you have to have a 4-year degree, and then once you get into the program is 27 months. I think you have to work somewhere in the healthcare field also for a year before you can even apply. So a lot of times when people want to be a PA, they work in a hospital, ER tech, or sometimes even nursing assistant or something of that sort, because they know they want to go to PA school. So they do their 4-year bachelor's degree, they apply for the program. When they're done, they take their state boards, their PANCE I think it's called, and they are a physician assistant. They are taught under the doctor's module. Now, as a nurse practitioner, we are nurses first. So we are registered nurses with a bachelor's degree, and then we go back to school and obtain either a master's degree or a doctorate degree. But whether you have a master's or a doctorate, you're still a nurse practitioner. But I'll do another video about master's degree versus doctorate another time. One of the big reasons, and I'm gonna say this, why I think a lot of people look at nurse practitioners as iffy and unqualified is because we are shooting our own selves in the foot by not requiring nurses to have at least 1 year of clinical experience before they can apply for these programs. There's a lot of patients who say that they do not wish to have a nurse practitioner care for them. They prefer for a physician assistant to care for them because they're more like the doctor and the nurse practitioner is more like a nurse. Sometimes when you enter a room and you say, I'm a nurse practitioner, a lot of times patients just hear nurse and then nothing else. And when the physician assistant walks in the room and say, I'm a physician, a lot of times people just hear that first word term first, and that is it. As we speak, I think there are 22 states in the US that nurse practitioners can practice independently of a physician. And I don't think that any of the 50 states or territories, a physician assistant can practice independently without a physician. Me personally, I think that this stuff need to be on an individual basis, because you have some doctors who are fool and they don't know what they're doing, even though they go to school for almost 10 years getting that MD behind their name. You have some nurse practitioners who are not that great. You have some PAs who are not that great. But to blanketly say that no nurse practitioner should have any form of independent practice authority, or no PA should have any independent form of practice authority, without looking at the individual, how many years of experience can they pass these different type of board exams, are competent enough to be able to practice independently. Maybe just a thought, I don't know. Personally, at where I am at, I do not think that I would be doing my patient as a service to say I'm going to open my own clinic now because I got it all there. And a lot of times individually you need to look into yourself and say, I'm not ready for that. Not that you will never be ready for it, but I know right now where I sit, I'm not ready for that. I think that I have 2 years now working as a nurse practitioner, and I need more experience. I need more experience, quite frankly. And I'm not saying that a physician is always holding my hand, and I would not be doing my patient any form of proper service to just jump and say, you know what, I am a nurse practitioner, and because this state says that I can open my own independent clinic, I'm just gonna go ahead and do it. You have to look into yourself and make sure that you are going to do your patient a service, a good service, and not just because I'm gonna do it because I can do it. So that would be definitely my advice to you guys. When it comes on to doctors, you know, trying to block a lot of this, it is what it is. They feel as if, you know, a lot of them feel like they went to school for a very long time, they were trained quite frankly rigorously, and they went through a lot, and we are kind of creeping on their thing, and they don't want that. I think that because of how the health industry is right now, it is making it more and more open season for mid-level providers, because the cost of your medical health is so astronomical, and especially when it comes on to a family practice physician. A lot of people who go into family practice medicine as a doctor, they have seen that it's not as much lucrative for them, especially when they're coming out of med school and their medical school debt is so high. A lot of them go into specialties that are going to pay them way more money, and then there is a gap now for family medicine, and that family medicine gap, the NPs and the PAs are kind of filling these gaps. So a lot of physicians are not trying to do family medicine because of that. The pay is just not there. I was talking to a physician a couple of months ago, and he was saying that he used to moonlight as a hospitalist in the hospital, and he's a family physician, but he used to moonlight in the hospital like on the weekends, and that job is just not there for him anymore because the hospital is more hiring PAs or acute care nurse practitioners to do those hospitalist jobs because they can do what? Pay them less money. What is the ultimate solution? Yeah, I wanted to kind of bring this up a little bit and talk about it. So shouldn't mid-level providers have the right to practice independently? Of course, I don't see a problem with it if that individual NP or PA is competent enough to do it, because quite frankly some of them are not. Some physicians to me are incompetent, and that is just facts. That is the truth. I have seen comments where people say nurse practitioner misdiagnosed them or PA didn't give them the right medication. Physicians do that too. People complain and say this physician misdiagnosed them or didn't do this or didn't do that. Problem to me comes down to competency. But if you know truthfully in yourself that you're just not there yet, don't push yourself just to say, well, I have my own practice. That's my thoughts on that. Let me know in the comments, what do you think about this? Should physicians still rally against mid-level providers getting their own right to practice independently? What are your thoughts? Let me know in the comments. As always, don't forget to like, comment, and subscribe to the channel, and I will definitely catch you guys up on my next one. Oh, I am going to do Vlogmas, so you guys are going to see me a little bit more often when Vlogmas start. Bye guys.